The following presentation is for informational purposes only. For medical advice or diagnosis, especially for such critical and debated health issues, consult a trusted medical professional. Welcome back to the deep dive.
Great to be here.
So today we've got quite the collection in front of us. We're talking articles, bits of research, transcripts, sources from places like the CDC, the WHO, even testimony from a U.S. Senate hearing, plus interviews with doctors and patient advocates.
Yeah, a real mix. And our job, as always, is to kind of sift through it all, unpack it, and pull out the key insights for you.
Exactly. We want to get you informed quickly and thoroughly on today's topic.
Which is?
We're diving deep into the current state of COVID-19, but with a very specific focus, how it's impacting older adults. We're looking at the factors, the issues, the latest science, all through that lens.
It's incredibly important. A lot has changed, but some vulnerabilities remain, or even look different now.
Right. So let's get into it. You hear people saying COVID's basically like the flu now, maybe even just a cold.
That narrative is definitely out there.
But when you look at these sources we have, they paint a slightly different picture. They're indicating the virus is still very much around and actually showing signs of a resurgence in 2025.
That's right, and they point to new variants driving this. Things like NB 1.8.1 and XCC. The descriptions we saw called them highly transmissible.
Highly transmissible. One note even mentioned how fast NB 1.8.1 spreads, suggesting it could, take over pretty quickly.
Yeah.
Okay, so the virus is still circulating, maybe picking up steam again. Let's really unpack why this continued presence is such a concern, especially when we focus on older adults, as our sources consistently do.
Absolutely. That's a thread running through almost everything we looked at, this specific and ongoing vulnerability of older people.
It seems even if newer variants cause, say, milder illness on average across the whole population.
Right.
The sources are really clear that for the elderly, the risk of severe outcomes and, crucially, long-term consequences remains disproportionately high.
Exactly. So the natural question is why? What makes older adults more susceptible?
Well, the sources highlight a couple of main things.
One key factor mentioned frequently is something called immunosenescence. It's basically the natural weakening of the immune system as we age.
So it just doesn't fight things off as well.
Pretty much. It's less effective at spotting the virus, less effective at launching a strong attack against it. That means older individuals might be more likely to get infected in the first place, and their initial response might be weaker.
Okay, that makes sense. The body's defenses aren't as sharp.
And then there's the second major factor, which the sources really hammer home: the higher prevalence of chronic underlying health conditions in older adults.
Right, things like
Diabetes, heart disease, high blood pressure, chronic lung issues like COPD, kidney problems, cancer. The list goes on.
And these aren't just separate issues existing alongside COVID. The sources directly link them to a much higher chance of serious complications, needing hospital care.
And unfortunately, a higher risk of death if an older person with these conditions gets COVID-19.
It's a tough reality. And even for older adults who do recover from the acute phase.
Yeah.
The sources indicate that the recovery journey itself can take significantly longer. It can be much more draining, impacting their overall health, their energy, their quality of life for quite a while.
Which leads us into something really fascinating and, frankly, quite sobering that emerged from the sources.
What's that?
Well, beyond just the initial sickness, the sources went into a lot of detail about the after effects. The sequelae, as they're sometimes called.
Like long COVID?
Exactly, that's a big one. But it's broader, too. These sources show a whole range of serious issues that can linger, and they seem particularly pronounced, more severe and longer lasting in older adults, affecting multiple systems in the body.
Okay, so let's start with long COVID syndrome then. What did the sources say specifically about that in older adults?
Well, they confirmed it's a major concern. Symptoms sticking around for weeks, months, sometimes even longer. But the key point for older adults was that these symptoms often last longer compared to younger people, and they tend to have a more significant impact on their daily functioning and overall well-being.
What kind of symptoms are we talking about?
Persistent fatigue came up a lot, like a really deep exhaustion that rest doesn't fix. Shortness of breath, too. Cognitive issues that brain fog people describe. Memory problems, muscle and joint pain, sleep disturbances, insomnia, and significant mental health impacts like depression and anxiety.
That sounds incredibly difficult to live with. Is there a clear treatment path?
Not really, according to these sources. There's no single defined recovery timeline or specific cure-all treatment yet. Management seems focused on rehabilitation, physical therapy, maybe cognitive rehab plus supportive care, and just really closely monitoring for any new or worsening complications.
And seeking specialist help.
Definitely. The sources recommend that older individuals with persistent symptoms consult specialists, pulmonologists for breathing issues, neurologists for brain fog, cardiologists if needed, and so on.
Okay, so long COVID is one major area. What other specific after effects did the sources highlight?
Lung damage was another significant one. COVID-19, especially severe cases, can cause intense inflammation and pneumonia.
And that can leave lasting damage.
Yes. Even after the infection clears, it can leave scar tissue in the lungs, a condition called pulmonary fibrosis. Basically, the lung tissue becomes stiff, less flexible.
Which makes it harder to breathe, I imagine.
Exactly. It impairs the lung's ability to get oxygen into the blood, leading to chronic shortness of breath, fatigue, especially when trying to be active. And the sources stress that older adults, particularly those who already had conditions like asthma or COPD, are at higher risk for this kind of permanent damage. Follow-up care, including imaging like CT scans, is often needed.
Wow, okay. Lungs. What else?
The immune system itself. Beyond the age-related weakening we already talked about, the sources suggest COVID-19 infection can have its own long-lasting negative effects on immune function.
So a double hit, potentially?
Sort of, yeah. This further compromised immunity can make older adults more susceptible to other infections down the line. Not just repeat COVID, but bacterial pneumonia, a worse bout of flu, things like that.
And I think I saw something about autoimmunity.
Yes, some sources mention studies exploring whether COVID-19 might trigger or worsen immune system dysregulation, potentially increasing the risk of autoimmune conditions, where the immune system mistakenly attacks the body's own tissues. It's an area of ongoing research.
Okay. Then there's the heart, right? We hear a lot about cardiovascular effects.
Absolutely. The sources confirm COVID isn't just a respiratory disease. It hits the heart and blood vessels too. And again, this seems particularly concerning for older adults and those with existing conditions like heart disease or diabetes.
What kind of issues?
Things like myocarditis, inflammation of the heart muscle itself, arrhythmias, which are irregular heartbeats, and worryingly, an increased risk of major events like strokes and heart attacks, potentially lingering even after the initial infection.
And why does that happen?
The sources suggest it's linked to the widespread inflammation the virus causes, and also its tendency to trigger blood clotting issues. If an older adult experiences new chest pain, palpitations, or unexplained shortness of breath after having COVID, the advice is clear. See a cardiologist.
It really seems to affect almost every system. What about the brain and mental health?
Yeah, the neurological and mental health impacts are significant, especially for older adults. Sources detailed problems like memory loss, slowed thinking or reflexes, and that persistent brain fog often being worse or more prolonged in this group,
Any idea why?
potentially related to inflammation affecting the brain or maybe even direct damage to nerve cells. There's also a concern raised in several sources about a possible link between COVID infection and an increased risk, or perhaps an acceleration, of cognitive decline, including changes similar to those seen in Alzheimer's and other dementias.
That's deeply concerning.
It is. And on top of the cognitive side, there's the mental health toll, the stress of being sick, the physical limitations, maybe social isolation. It all contributes to higher rates of depression, anxiety, and insomnia reported in older adults post-COVID. Comprehensive care, including psychological support, is highlighted as really important.
You mentioned isolation. I remember reading something interesting about loss of smell, too.
Yes, that came up. Some sources discuss research looking into whether that temporary loss of smell many experienced during acute COVID might potentially be linked to later cognitive impairment. Another area to watch.
Okay, so new problems like lung damage, heart issues, brain fog. But what about existing conditions?
That's the final crucial piece. The sources emphasize that COVID-19 doesn't just cause new problems. It can significantly worsen health issues people already have. And this is a huge reason why older adults with chronic diseases often have such severe outcomes.
So it throws existing conditions out of whack.
Exactly. Things like high blood pressure, diabetes, chronic kidney disease, liver problems, even cancer. The sources list these as conditions whose management and stability can be seriously disrupted by a COVID infection. The virus, the inflammation, it just adds a massive stressor to the system that can make these chronic illnesses harder to control and potentially progress faster.
Right. It's a complex and frankly quite worrying picture for older adults. So given all these risks, what do the sources say about prevention and management?
Well, unsurprisingly, prevention is framed as critically important, particularly for older adults and anyone with underlying health conditions.
And vaccination is part of that discussion, right?
It is. Some sources, like those referencing CDC recommendations for the 2024-2025 season, highlight vaccination as a key tool. They emphasize its importance for most adults, but especially for those 65 and older, people at high risk, and those in long-term care. The stated aim is protection against the worst outcomes: severe illness, hospitalization, death.
And they mentioned talking to a doctor.
Yes, consulting a doctor is advised, especially for older adults with complex health histories, before getting vaccinated, just like with any medical intervention.
Okay. But if we look across all the sources, especially that Senate hearing testimony,
Right.
it's clear there's still significant debate and very different perspectives on the vaccines, isn't there?
Absolutely. The sources definitely reflect that ongoing controversy regarding efficacy and safety. The Senate hearing material, for instance, presented claims of alleged censorship of information critical of vaccines by health agencies and tech platforms.
There are also questions raised about informed consent.
Yes, specifically citing the language used for products under emergency use authorization, the EUA, which stated people were under no compulsion, juxtaposed against situations where mandates were in place.
And that testimony also brought up package inserts.
Correct. Claims were made in the hearing that death wasn't listed as a potential adverse effect in vaccine inserts, despite the witnesses presenting autopsy findings, which, they claimed, showed a high percentage of deaths examined post-vaccination were caused by the vaccine. Again, it's crucial to state these were claims and interpretations presented during that specific hearing.
Conflicts of interest were also alleged in that testimony.
Pointing to things like pharmaceutical companies having liability immunity, journals allegedly receiving funding from pharma, and accusations that health agencies acted almost like partners with the industry.
And the efficacy debate itself was quite stark in the hearing materials.
It was. On one hand, you have sources citing models claiming millions of lives saved by vaccines. On the other, witnesses in the hearing challenged those models and presented interpretations of other data, asserting their belief that the vaccines didn't actually reduce the overall risk of death from COVID-19.
So very different readings of the data from places like VA-EARS, the Vaccine Adverse Event Reporting System, and autopsy results were clearly presented.
Exactly. VA-EARS itself is complex. It's a passive reporting system where anyone can submit a report, and reports don't automatically mean causation. But different groups clearly interpret that data very differently.
And there was a clinician who spoke about treating patients.
Yes. One witness described treating numerous patients with both long COVID and conditions they identified as vaccine injuries. They noted that while unvaccinated people certainly get long COVID, most of the patients in their specific clinic presenting with these issues were vaccinated. They stressed a need for better data to really untangle post-COVID effects from potential vaccine effects.
So it's really clear from the source mix that this is a deeply contested area. Lots of different viewpoints, strong opinions based on varying interpretations of data. We're just relaying what was presented in the materials we reviewed.
Precisely. Stepping back from that specific debate, though, the sources also consistently reinforced the value of other, more traditional public health measures, especially for vulnerable groups like older adults.
Like what?
Things like masking in crowded indoor public spaces or during high transmission periods, trying to maintain some physical distance when possible, and of course, good old-fashioned frequent hand washing. Simple, but still effective layers of protection.
Okay. So beyond trying to prevent infection, what about managing the situation for older adults, especially if they do get sick or are dealing with lingering effects? How can they or their caregivers support well-being?
The sources offered quite a few practical tips, actually, drawing from various experts and advocates. For those long-term symptoms we discussed, a multidisciplinary approach is really recommended.
Meaning seeing different specialists.
Yeah. Consulting the right people for this specific problem, cardiologists, neurologists, pulmonologists, mental health professionals, to get a proper assessment and a coordinated management plan.
Lifestyle factors must play a role too.
Huge role. Maintaining a balanced, nutritious diet came up repeatedly. One source specifically mentioned exploring an anti-inflammatory diet. Things like reducing sugar, maybe limiting wheat or gluten for some, could be beneficial for immune support and overall health.
Sleep and stress management.
Absolutely critical. Getting enough quality sleep and finding ways to manage stress were highlighted as fundamental for both physical and mental resilience.
And activity. I imagine it's easy to become deconditioned after being sick.
Very easy. So counteracting that deconditioning is crucial. The sources strongly recommend suitable physical activity and regular exercise. Even gentle stuff counts.
Like what?
Walking, chair exercises if mobility is limited, maybe using online resources designed for seniors. It's not just for physical strength, it's vital for immune health too.
And what about the mental and social side? Isolation seems like a big risk.
It really is. The sources stressed how important maintaining mental and social wellness is. Staying connected with friends, family, using video calls, the phone, whatever works.
Keeping the mind active.
Definitely. Maintaining a daily routine, spending time on hobbies, even small household projects. Stimulating the mind with puzzles, reading, and getting outside for fresh air and sunlight when possible. All these things help combat loneliness, depression, and potentially cognitive decline.
Seems like common sense, but easy to neglect when you're not feeling well.
Exactly. The sources also touched on efforts to improve access to things like vaccines for older adults, setting up clinics at convenient places like pharmacies, senior centers, even offering home vaccination options in some areas.
And there was one last practical tip about preparation.
Ah, yes, the bonus tip. Getting organized.
Yeah.
Especially useful for older adults or their caregivers. Pulling together important documents, medical records, medication lists, key legal and financial papers, and making sure a trusted family member or power of attorney knows where everything is just makes navigating healthcare smoother, especially in an emergency.
Okay, so wrapping this all up, our deep dive into this stack of sources really shows COVID-19 isn't necessarily fading away quietly. New variants are emerging, and the sources consistently, forcefully highlight the unique and ongoing vulnerability of older adults. We've seen potential for serious long-term impacts across so many body systems: lungs, heart, immune system, brain.
Right. And we've touched on the prevention strategies discussed, including that very complex and debated topic of vaccination, making sure to represent the different perspectives presented in the source materials.
And hopefully we've pulled out some useful practical tips from the sources on managing risks, supporting physical and mental health, and just being prepared.
At the end of the day, it seems the key message is staying informed, critically evaluating information from various reliable sources, and, crucially, having those personalized conversations with your own healthcare providers. They know your specific situation best.
Definitely. So here's a final thought to leave you with, building on what we've discussed. Given everything these sources suggest about the persistent nature of COVID and its particular challenges for older adults, how do we as individuals and as a society really ensure our communities are set up to effectively support and protect this group moving forward, especially when navigating such different views on risks and how best to manage them? Something to think about. If you found this video helpful, please give it a thumbs up, share it with friends and family, and subscribe for more health insights. We'll see you next time.